is the afterword of the Thursday, the 14th of February. Happy Valentine's Day. If you have a Valentine's partner with you, having dinner earlier on, celebrating this occasion. So in this particular video, I'm going to talk about the thalassemia patient traveling abroad, plan to study on abroad, particularly the thalassemia intermediate as well as a thalassemia major, because they are differently. They have to undergo the blood transfusion, the blood tests, screenings, MRIs, have to take medication and inculators, so they are totally different. So unlike the thalassemia minor, which they can do everything they want, of course, like anyone else. My mom is like thalassemia minor. She's well off, can go anywhere you want without even having to take these supplements. So a few days ago, I received an Indian guy message. He's living from India. Could not be Indian guy, but he's from India. He's like 16 years old, and he said he's planning to study abroad to Canada University, and asked whether I have any advice or suggestion for him. Of course, I myself do not have the experience. I do not really travel abroad to study or even go alone before. I normally go with my family just for holiday, but not to Canada though. So what of course I do not have the experience or advice to give him, but I imagine myself having to like study abroad. What are the plans I would prepare before really tend to travel abroad for like few years, at least 2 or 3 years, I believe, or more, up to 5 years university course. So let's say in particular, maybe just say 3 years, don't make it too long, 3 years. So the first thing I would do, I think, is to talk to my thalassemia doctor, the hematology doctor, to really check with the doctor whether it is really possible to really study abroad. Of course, anything is possible, but you just have to verify it, because there's many issues to take note on that, such as where you have your blood transfusion on the Canada sites, and the doctor consultations, where to take the medication supplements, whether they have the supplements and medication, because when you go there, everything is different, change. Every area has its own like the rules on regulation, how they do things, and also the price charges will be different completely, and no one there. Yeah, so not like your own town where you feel familiar to the place where you visit the place regularly, and you know the nurses, the doctor there. So you have to check everything before doing that. And as well, if the doctor might suggest you to come back maybe every 6 months or a year, to come back to your own country to have your doctor consultation and review how your medical status is going, whether you are doing fine. Yeah, and of course, if you are doing that, you have to have your transfusion over the other side, unless you want to come back every 3 weeks to a month for your regular blood transfusion. You definitely do not want to come back. You will waste your money, waste your time. Yeah, and mainly the waste of time, because every 3 weeks you have to come back. Imagine you are staying in India, you have to go to Canada, or you're staying in Singapore, you want to go to US. That's a really far journey. You definitely do not want to do that. So make sure you check everything before you go there. Of course, it is possible though. Everything is possible. Some patients suggest that they like have enough like chelators or medication for at least a year, so they do not need to come back that often, so they can last for a year enough. Some patients even plan to like take 2 years of medication, but remember, medication you can't keep long. You might want to take up front for some medicine who are able to keep that long, but you still required to review your medical status, just to see whether that your blood test, everything's fine, your overall condition, and as well as the dosage for your chelators, whether everything is unchanged, is good for your current conditions, whether it's enough, the calculator is enough, it's good for your condition. And if your family allowed, then probably you can do it. But it's better if you have someone accompanying you to study abroad. It's better that someone to take care of you, because you go to a new location without any friends or parents giving you advice, and you are young kids, you might fall for the bad of turn out bad or get cheated. You never know of that kind of stuff. Because when you travel abroad, you might need to stay in their kind of resort, or you need to rent a room or house there, or share room with your friends or partner if you have any to stay in the room. So I advise is like accompany someone to there. If at least if your friend want to study abroad, it's better than rather you yourself go there. Of course you can make friends there, but it's up to you to decide though. So that's basically just a little video talking about the thalassemia intermediate and thalassemia major patient planning to study abroad. Thanks for watching. I'll see you guys in the next one. Bye for now.